If you need to get yourself a drink or anything, that's absolutely fine. We're
I'm
just going to,
absolutely fine.
fantastic. Um, Thank you so much, Dr. Adil, for giving me the time
You're
to
very well.
discuss your what you've been through. You're based over in Milton Keynes, aren't you?
I am based in Milton Keynes, Laura. Thank you for having me today.
Oh, it's my pleasure. And we met last week. I met Manju. I did see you. I saw you at an event in London. I remember seeing you at this event in London.
Yeah,
We
that
just
was
got,
a while ago, 3 years
it
ago, when
was,
we
yeah,
started
yeah,
some rallies at Trafalgar Square and Hyde Park.
yeah, that was amazing. So
Yeah.
if I'm just going to, let me see if I can't actually see any comments. This is bizarre. There's no comments. So that's very strange. I have no comments, guys. So if anyone's got any comments right now or saying anything, I cannot see anything. Now, this is a first. So what I'm going to do is log it. Oh, hi. Oh, they're coming in. They're coming in. Hi, Lindsay. Hi, everybody. Excellent. I'm still going to try and log into my laptop. So as soon as we get, please share this live and let's see if we can bring people on. So because this is Dr. Adil and we'd like to get his story and his message out there. While I've got Facebook, at the moment, I'm really pushing the boundaries with Facebook. So let's see how long they let me do this. I'm going to read Dr. Adil's, right, there we are, a bit about his history as an introduction. And then we're going to speak about, I'm going to let Mr. Dr. Adil take over. Thank you, guys. Please share it. Right. So here we go. And I'm sorry for anyone that, hasn't joined yet. I am trying to wait because I can see the numbers are coming up. Again, please share the live as much as you can. Right. Here we go. Here we go. Can everybody hear us okay? Okay. I have a High Court case hearing against GMC on the 15th of February 23 at 10:30 in London. So this is not long now, is it? And it's Dr. Mohammed Adil versus General Medical Council. I would like you to attend this historical hearing. It's a public hearing, therefore anyone can attend. My story in brief is as follows. I qualified fellowship, FRCS, I'm not quite aware of those medical terms, from the Royal College of Surgeons in Edinburgh, UK in 1996 and RCS Ireland. I have been trained in UK and Ireland with 30 years of unblemished record without any cause for concern by the GMC or NHS throughout my working diligently with great enthusiasm in UK and saved thousands of precious lives and treated many thousands of patients successfully without any untoward incident. In early 2020, the entire world got confused due to the propaganda of the COVID pandemic with lockdowns, extraordinary restrictions on public, closure of all the health services in the UK, hundreds of thousands of elderly patients dying in nursing and care homes, suicidal rates amongst youngsters rocketed by sky high. People lost their economy, business, loss of education system, and serious mental and physical health issues. It's, when I read this is, by the way, this is what Dr. Adil has wrote. When I read this, I just can't believe that we actually went through this, honestly. There has been total violation of the civil liberties, freedom of speech and expression, human rights, and medical ethics. I predicted millions of patients would go on the waiting list, which has come true. In April 2020, I predicted about the vaccination rollout as an end point of the entire scenario to reduce world population, which has come true. hundreds and thousands of vaccines, rebates, injuries, deaths, myocarditis, strokes, paraplegia, dementia, respiratory failure, and clots in legs and lungs reported, with sudden deaths in youngsters due to the injection injuries. At the time, I was working in North Manchester Hospital Trust when I raised my concerns in the favour of public in a couple of my videos over social media. I remember those videos. I remember seeing you. When I was dismissed abruptly by the Trust on the 22nd of the 4th, 2020, by the order of the medical director, without any notification, advice, charge sheet, notice, or following any disciplinary procedures, and I was asked to leave the Trust. I had no clinical, ethical, social, patient-related, or health issues whatsoever.
Correct.
Same sequence was repeated in Pilgrim's Hospital, Boston, United Lincolnshire Trust on the 7th of the 5th, 2020, when I went to the locum there. MD, I'm not going to mention names, dismissed me, unless you want me to mention names, I'm not entirely sure, but maybe best at the moment not to, dismissed me due to my same video holding my opinion over COVID-19. I was dismissed suddenly without any advice or charge sheet notice and failed to follow any disciplinary procedures, warning, or prior notification. I had no clinical, ethical, social, or health issues whatsoever. On the 25th of May, 2020, I received a letter from the GMC alleged for 3 online complaints by unknown members of the public. And Mr. So-and-so, Mr. So-and-so, and Mrs. So-and-so, and Miss So-and-so in my video of COVID-19 on the social media, and was advised to attend IOT hearing of the MPTS on the 1st of the 6th, 2020. I was declined adjournment due to short period of time and lack of GMC bundle notes consisting of 246 pages, which were provided to me during an IOT hearing on the 1st of the 6th, 2020, and asked to go through in 90 minutes, which was unfair and unlawful. So what did they do? They gave you the bundle and you didn't have time to read it?
They actually never provided me the documents of the case, which legally they should have provided before.
Yes, of course they should.
Going for the proceedings. So during the hearing process, I only had 2 pages note in my hand, which I received on 25th of May to attend this IOT hearing of the General Medical Council. I had no other documents provided to me prior to the case. When they started digging into the note, which they had, I didn't have, they mentioned about 120 pages and 240 page and go to this. I said, which page you're talking about? I don't have anything.
You don't have it.
Two papers which you have provided me. I have no other document at all.
I've seen this happen time before.
Oh, sorry, we haven't provided you. They then, on my request, they provided me the bundle of the General Medical Council consisting of my case notes online on the same email where we were talking about. And they asked me to go and read this bundle, which consisted of 246 pages, and then return after 90 minutes, and then we'll carry on. You can imagine that who can read that at 246 pages in 90 minutes?
I've witnessed this myself firsthand. They've done this to a number of people. So this was unfair, unlawful. On my return, I was suspended for a period of 12 months by the IOT in a brief hearing over the Skype, and my license to practice medicine in the UK was stripped. Several appeals to the IOT and chief executive of the GMC were declined, which I made after my suspension order, which caused serious damage to my reputation, career, total loss of income, livelihood, and mental traumas to my family and 3 school children and their well-being. After my suspension, the GMC started with a witch hunt, as GMC is famous for the witchcraft in walking to various trusts where I had worked for the last 3 years to collect some clinical material to generate clinical and mental health issues to reinforce their case. But they miserably failed to prove any clinical or health-related cases. So basically, they were trying to stitch you up.
Yes, that's right. They're good in the witchcraft business.
Yeah, absolutely.
To my suspension. So many hundreds of doctors, they have done it. You know, in October 20, to reinforce their case, that's what they went to different trusts. And they were looking for some clinical material against me to reinforce their media-related case, which was totally based on the freedom of speech and expression, which I expressed on my videos at my free time. Nothing to do with my patients or during the hospital work at all. So this was taken so seriously and with such a harsh punishment to me, with dismissal followed by suspension by the General Medical Council for 12 months.
So then you go on to say, in October 2020, the government rolled out the mRNA vaccine in a collaboration with the big pharmaceutical companies with full indemnity and injected into the public without informed consent. These are your words. You know, you're a doctor, you're amazing for saying
knows
this.
That.
Yeah, absolutely. After 12 months, the GMC extended my suspension order for another 12 months and referred me to medical professional tribunal for decisions and hearing fixed on the 13th of the 6th, 2022, then the 1st of the 7th, 2022.
The reason for, sorry to interrupt you.
Yes, fine.
They extended my suspension order for another 12 months. And there was no reason to refer me to the medical professional tribunal because my case of the media-related allegation did not fall into the one of the categories of the 12 categories of referral to the medical professional tribunal, which is a part of the GMC, but they pretend to be independent.
Yeah,
but they are all cahoots with each other.
Yep, absolutely. So then, which is what, there you go, on the 11th of the 1st, 2021, my suspension order was lifted by the IOT of the GMC with 14 conditions imposed on my license to practice. Was that meant to be the 1st of 2022?
This was on the 11th of January 2022.
Right, yes, so that's meant to be 22. So with my license to practice, which created serious difficulties in securing my job, as trust would have to employ 2 consultants, one my supervisor and myself. What 14 conditions? What were those conditions?
Yeah, one of the conditions was I need to have a supervisor. Can you imagine that? A consultant of my caliber and my qualification experience would require a supervisor to supervise my job.
In other words, to keep an eye on you.
I work in this country for 30 years at a very senior level, and my post-fellowship experience since 96 is over 27 years. And who will supervise me for this job? This was totally the wrong condition.
Of course.
I had no clinical condition which I needed a supervision for, a consultant. So nobody would supervise me because they knew that no consultant, all the consultants who were working under me, they have trained so many, hundreds of thousands of consultants in this country for my 30 years of experience. They were registrars, SHOs, and they became consultants. Who was supervising me? Nobody will. So trust will employ a supervisor to supervise me, look my work, how I'm doing, and then they employ me. So that's why no trust would take will accept me to be supervised by a named consultant who should be senior to me. That's why I had a difficulty in securing my job.
So despite 14 conditions, I secured a job in Morriston Hospital, Swansea Bay Hospital, Wales, for a period of 6 months. which I commenced on the 30th of the 5th, 2022. But GMC paralegal team approached and manipulated trust to get me terminated on
That's
third
right.
day
Yeah.
of my job.
Yeah, I know who were these guys who went there, and they manipulated the assistant medical director of the trust, who wrote to me that they have approached me, and they got my job terminated out because they wanted me to attend the medical professional tribunal services, which was on 13th of June. So after 3 days, they got me out of the job, which I had serious loss of my financial resources. I got this job after 2 years, in fact, you can imagine that. And I just started that job, and they approached the trust, and they got me terminated from that job.
Wow. Wow. So I attended MPTS hearings on the 13th of the 6th, 2022, on my own, where GMC failed to prove its case against me without any witness, proof, evidence, or survey that my video has damaged members of the public and profession. So,
Correct.
but they again suspended me for another 6 months for the safety of the public, from which I don't understand. Well, we do understand it, but we know why.
Honestly, this was total a made up of the medical professional tribunal. None of them was a doctor. There was one old GP retired. She was hardly speaking anything. She was a silent listener. The chairman was very active, along with in cahooting with the GMC, and there was another lawyer there. None of them had an experience of how to deal with the medical profession. They don't know even the medical terminology at all, and they were formulated to crucify me in the medical professional tribunal services. And there was no reason that my conditions, my suspension was lifted by the interim order tribunal on 11th of January 2022. And then the medical professional tribunal, they suspended me again without any justification, because no untoward event happened in between 11th of January 22 until 13th of June 2022 to justify their further suspension against me. During the trial period, I was on my own and I argued very decently and nicely. And I requested their medical counsel. They had their own barrister, they had a lawyer, they had 4 other members. So I faced 6 of them, and I went to the witness box. Although I shouldn't have been, because I was defendant. The defendant don't go into the witness box, but I did. I did sit into the witness box, and I took an oath on the Bible and on the Holy Book, which I very much respect and honor. I sit there. I took an oath on Bible, and I explained what exactly has happened. I had no clinical issue. I had no medical health issue at all. But I requested them to please bring those 3 online complainants who had made these complaints.
Yeah, bring me the person who's,
That I had 3 allegations against me.
But where are the people that made that?
Yeah, my videos have caused damage to my patients. I said, give me any evidence or proof or any witness who can come and say that my videos have damage to my patients, members of the public, and have brought disrepute to the profession. And they had no survey they conducted. They had no evidence or proof to prove their case. So they should have dismissed my case. You know, the chairman of the medical professional tribunal was a pharmacist, and he was involved in multiple medical pharmaceutical companies. And obviously there was a conflict of interest, which I highlighted prior to the hearing, but I was not heard about that. Anyway, so I faced the trial. There was no proof against me and no evidence to crucify me further, from condition to suspension. But they said, you have Mr. Adil, he wrote his determination on 29th of June. Mr. Adil has no complaint, no problem with his patient, but he has excellent track record, but for the safety of the public, we are suspending him for another 6 months. I don't understand. I question him. Mr.
Yeah, yeah.
Chairman, could you please describe what safety you're talking about? I'm not a drug trafficker. I'm not a sexual offender. I'm not a criminal. That the public love me. You know, many thousand. You try to silence me to give a message across to the wider medical community to keep them silent. But
Yeah.
you could not keep me silent. You suspended me. But many thousand came to listen to me. 60, 70, 80,000 people, they all came to listen to me
That's
because
right.
they wanted to make me silent. So,
Yeah.
so people were with me. Still, I had millions of people, my followers across the world, but they are talking about three unknown complainants who were never identified. They never came forward. Whether they existed or not, they were all fictitious. And this was totally unjustified suspension. The entire case was totally unjustified.
Yeah.
This was
Yeah.
not the way, first, by the trust to dismiss me without any notification, and it was not a case for 12 months suspension, followed by another 12 months, and then going to approaching the trust where I started working, just working, and 3 days later they terminated me, and then they brought me into the medical professional tribunal where they resuspended me, and I had no choice but to knock the door of the High Court because for the justice. So
Fantastic.
that is what I'm standing for the justice, for integrity, and for the truth, for standing with
So
the public and speaking the truth.
excellent. Fantastic. Let me just rewind. Let me rewind of the first time I ever saw your video.
Yeah.
I remember, and please correct me, but this is what I remember. You came online and you done a video and you said COVID-19 is a hoax.
Yeah.
Is that right?
Well,
And
yeah. This was for many reasons because they just manipulated this world. We're talking about COVID-19, right? They how can they prove that this is not a hoax? They have never proved it.
do you
If
know
I
what?
say it's hoax, they
You've
never
just
prove
said
that this is not a hoax. This is a real.
that's right.
They have never proved. I challenge them that they prove me which paper, only one paper from Kim from the China. She wrote one paper, and there was on the Canadian website on the university there was a note that we have noticed some virus which will cause several million deaths, and we have not seen that. The way, you know, the term hoax was used in a sense that people were so confused the way they were portrayed
Yeah.
about this virus, and they
Yeah.
closed the entire world, the lockdown,
Absolutely.
and the loss of economy, travel restrictions, loss of human rights, loss of civil liberties, violation of the medical ethics. None of the medical professionals were conducted before putting the country into the lockdown. There was not a single scientific debate before embarking the country into the lockdown, which resulted into massive problem to the health services were all seized off. 99% GP, they stopped referring the patient. At that time, I remember there was a waiting list of 4.1 million patients. Out of that, there was 1.5 million cancer patients. I am a breast cancer surgeon, and I'm a bowel cancer surgeon, and I do a lot of keyhole surgery. I'm a very trained surgeon. My results are excellent in this country, and I had a lot of patients who were under my care, and they were waiting for their surgery, and they were asking me, what's happening? One, we're going to be investigated, but all the doors of the hospital were shut down. We have not seen the floods of patients which were predicted by the Imperial College and the SAGE group, that millions of patients were rushing into the hospital. The hospitals were empty, the wards were empty, the intensive care units were not having that sort of patient which they are predicting. I'm witness of that case. So I
Yeah.
raised this issue that how can you transfer these elderly patients into a nursing home without testing and trials? They were not even tested. They were referred to the nursing home and the care home, and poor people, hundreds of thousands, 78,000. I remember that figure. Within 3 months, they passed away with, with negligence, lack of medical facilities, dehydration, isolation, and depression. Similarly, many thousands died in their own home because of lack of medical facilities due to heart attacks, respiratory failure. They didn't die because of the COVID. They died because of the negligence. And I predicted that the waiting list is going to pile up to million more. So now I was right. Now the waiting list is more than 8 million people waiting for even more than that. They're not telling us the exact number. And how I have seen the misery of patients into the accident emergency department waiting for 24 to 36 hours, but they're not getting anywhere. 60 to 65% patients are gone into the private sector because they're not getting treatment for their cancers, for their other surgical problems and medical problems, and they're dying. So many died during the last 3 years. We have no clear records that how many have died during that period.
And a lot of these deaths were actually put as COVID-19 deaths when they weren't.
Yeah, the COVID. The test they were using. This is abandoned now since long time. In many countries, is not being used because this test was not accurate at all. There were a lot of flaws in this test.
Which is, yep.
90% patients would have positive test with the PCR. And if you repeat that test, and if you go from one laboratory to another, they will have different results. So they relied upon this false test, which was designed for the prompting the number of patients to reflect that this is a surge for the COVID-19, which as a scientist I can argue and justify. I've seen my own children. My son who is a GCSE. One day he came, he told me that he's positive. I said, well, bring me another kit, and he did that. He said it's negative. So immediately the two kits were different. One was positive, one was negative, and that released his anxiety, and he went to school. Similarly, this test was used on millions of people who were test positive, but doesn't mean that test positive people should have been isolated for 2 weeks, 4 weeks, 6 weeks, and people used it as a tool for staying at home. They were working from
Yes.
home, and millions of people they were doing nothing, but they were paid and furloughed
Yes.
payments, and so many things happened in the last 3 years. Now we have
So
seen
as
the effect of that.
So what we had is people that couldn't even get to see the doctors and get their medical procedures done, and we had people abusing the test to be able to stay at home. So there's people dying because of these false tests, and then we've got people using it to their advantage to be able to stay at home.
That's right. No, this is what I predicted, without having any personal gain at all. I stood for the cause of public, for the humanity. I stood on my medical ethics that do no harm. I did not want to be part of that scam.
Can you tell us about the medical ethics? Can you tell us when you became a doctor?
I believe on my medical ethics. I believe on the Nuremberg Code. I believe on the Geneva Declaration. I believe on the Helsinki's Declaration. Don't want to go into detail. People know that by now that what I'm talking about. And the oldest one is Hippocratic Oath. First, do no harm. I'm satisfied that I've not done any harm to anybody. I try to protect the public. I tried to make an argument with the scientists who had decided to lock down the country. If this was a plan to do it, I couldn't stop it. But there was no real science behind it to prove that lockdown was necessary. It was not necessary. Lockdown has damaged so many people. Like they have taken away their livelihood, loss of economy. People have lost everything, their jobs, their small and medium size industries are gone, their small businesses are gone. People had mental and physical trauma, and they and they are still suffering. Many thousands, millions of people died because of stress, anxiety, and still people are worried, they're uncertain, they're living in darkness, they're not getting a medical treatment, and
Yes.
it looks like there's a darkness everywhere. But one thing I'm sure, you can see the shiny stars when there is complete darkness everywhere.
Yes. That I
So
was with you that day when I wrote that quote because I thought that quote was amazing.
so
But
yeah, so this is I believe
we
that
still
still
have
there are people who stood with me. They came with me in Trafalgar Square. They came
yes.
everywhere. They're still standing. They understand I was right at that time, and I did not betray my medical ethics. I stood for the medical ethics, and I'm
Well, it's
very
just you are one of a few who has not only stood in your oath, stood in your truth, put the people first, spoke the truth at all costs, including to your career, and now you're facing all this, and and
you know
you were trying to fight for the people because you saw that actually COVID, there's no scientific proof, but we've got proof that these people need surgery. They're suffering with cancer. They're suffering with this,
yeah,
so they need
absolutely.
help
But
now.
you know what I suggested them at that in the early 2020. I said, well, let's treat COVID on one side. If you think that people need treating COVID, and treat the other patient who are cancer patients, the serious patients who require urgent surgery and medical care, angiography, and the heart transplants and lung transplants, and so many things that they needed. They were totally ignored. Can you believe that? That in the last 3 years they have treated only COVID. That's my prime question to the government. That
Yep.
other than COVID, what have they treated? Where's the other? The scientific advisory group, they had either forgotten or it was a deliberate attempt to treat only the COVID patient. They forgot about millions of non-COVID patients, who, including the cancer patients, the cardiac patients, the heart patients, the people having respiratory problems, lung problems, diabetes, leukemias, paraplegia, strokes, dementia, and they ignored them. They did not realize that these patients are going to die. That's why we got the death rate is gone up. People are depressed. They are under stress and anxiety, and people are dying because of that reason. And they are. It's difficult to get them out of this trouble unless we get the government showing its empathy with the public, who are millions of people that are waiting for the investigations of treatment, especially the cancer patients.
Yeah.
And not
So
all of them can afford to go privately. That's why
no.
I have empathy with the patients and the public and the system.
What about the rest of your team? I mean, you are a very intelligent doctor who's able to think rationally, to weigh up, hold on a minute, something isn't right here. You've got a science mind, you've got this, that. So, but what happened to the rest of the team? Why weren't they speaking up like you? Did they not see that something was wrong?
Doctors are speaking now. They have understood. Many
Yeah,
doctors
but
are coming forward, and they are speaking, and they're joining us. They're talking from different part of the world, and I must appreciate their study, their devotion, and their sacrifice. And they have made sacrifices. But many doctors, they know it what's going on, but they are put into a lot of pressure of losing their jobs and the economy and the families and all sort of things. So it's what the GMC says. We crucify doctor to send a message across the wider medical community. To
yeah,
this is totally unacceptable, unethical, and is criminal. This should
it's
not
shocking,
happen.
isn't it? What was the
Yeah, I,
fear?
I give
What
my
was,
opinion for the benefit of the public, for the
yes,
economy, yeah, for the humanity. I stood for them. I wanted to make a debate with the scientists. I invited them. I still invite them to come and debate me whether lockdown was justified or not. I still, on any channel, they can come and debate with me. I'll bring my team of scientists. I'm not a layman with 35 year experience in this country. I'm a surgeon, I'm a teacher, trainer, researcher, and I'm international speaker. I've got an award for that. I told them, look, if you could justify your lockdown was right, I will give up. I will apologize to the public I was wrong. If you justify that every healthy patient, including the children, should be vaccinated, I will leave it. I will quit my job. But they don't want to come because they know
No.
that. Because we have seen most of the medical establishment were the partners of the medical pharmaceutical companies, and they were shareholders. And I
Yes.
know them, and they know them. What I'm talking about. They must be listening to me. This is a message that where I'm standing for on justice. I'm standing for integrity and truth. That neither the lockdown was right, which has damaged so millions of people, their economy, their health, education, mental and physical health, especially the elderly people we have lost them without seeing them. They were tied up and buried without seeing the loved one in the last moments of life. This has been totally unacceptable. And disabled children, they have suffered a lot. And the children who, since 3 years in a state school, children are not going to school.
No.
They have built up habit. They're not going to school. There is a tremendous loss of education and the health, education, and economy, and a lot of other things. You see, you can imagine that. It's unbelievable.
It's I was in complete awe of you when I saw you speaking up when I was just waking up, and I knew there was a problem. I'm not a scientist, I'm not a doctor, I'm not a nurse or anything, but I knew there was something wrong. And it was because of people like you, Dr. Adil, who was speaking up and putting the truth out there, that we all became aware of what was really going on. It was because of people like you. And I'm sorry that you've had to suffer, but you are an absolutely incredible man standing in your
Yeah, you
truth
have to,
and willing to
for the
fight.
truth, I believe for the truth, you have to pay the price for that. But the gain
Yeah,
is much more higher than the what I've lost. At least my conscience is clear. I have not done any crime. This is message to the public and the government. I've not done any crime. Only thing is, I question about the way they portrayed the virus, put the lockdown, and that resulted in serious problem to the public health. And they rolled out the vaccine with full indemnity with the pharmaceutical companies. Healthy people were vaccinated. Now we see the effect of those, which I said that early in 2020.
yeah,
The vaccine was, how the people lost their civil liberties. They were not able to travel. They were not able to go to work. They were not able to go to job, or they were not paid their salary unless they were vaccinated.
yeah,
This was not informed consent. The General Medical Council, I this is a message for General Medical Council. They encourage us to get the informed consent from the patient, but here they injected people without their consent. Consent is when you tell to the patient about the advantages, disadvantages, possible outcome, and the danger. Then patient would decide whether they want to go ahead or not. Even patient have right to withdraw their consent or at the right on the table or the operation table. They can withdraw their consent. But we tell them, I believe on the scientific debate. I believe on face-to-face appointment. That's a consent. We tell to the patient that this is going to be a treatment. This could have possible complications. It could end up into this. It could have a serious impact, and it has advantages and disadvantages. After discussion and patient, we give chance to the patient to make up the decision. to make up their mind whether they want an operation or not. Many patients say we don't want an operation. We say we can't do anything. So we just leave. We explain everything. This is our moral duty. That's all about the Nuremberg Code, and as which reminds us of Nazi atrocities when they perform lethal operations on the living human being, rather
Yeah.
fatal operations, without taking consent.
It's just crazy.
And
What
this
about?
vaccination has
Yeah.
been injected to the people forcibly without taking informed consent. Now we see, I have addressed this issue in the House of Commons and House of Lords and the Parliament with various MPs, and I have addressed this issue that look, these people, hundreds of patients came, they were paralyzed, they lost their loved ones, and they had serious complications related to the vaccine. But I said that, but look, these patients who were normal before that, and after the vaccine, this is the end point. So
Yeah.
if there was a benefit of that, it should have been. Usually, we as a scientist, I know that I have trained so many scientists who are working in Oxford and Cambridge in the last 30 years. I'm a qualified person. I'm not a layman. I'm not a junior doctor. For any vaccination or medicine, we especially for the vaccine, we need 5 to 10 years before the proper testing and the trials are completed before rolling out into the market. But here, the vaccine was rushed by the government. That's my objection. Within 3 months, with the indemnity. Why they took indemnity in the beginning? Why they rushed into rolling out the vaccination? What the excuse is? People were dying because of the COVID-19, but that is not right. They can't prove it. People were dying because of lockdown, due to stress, anxiety, due to dehydration, due to
What
lack
about
of
the
medical
mask?
facilities.
What about mask
Mask,
wearing?
mask, yeah, mask wearing, mask is never helped. It was all dangerous. I never favored the mask. Social distancing was totally rubbish. And as a surgeon, I use the equipments which were used, personal PPI, the personal
PPI,
protective equipment, yeah. In the very beginning, very heavy dresses, helmets. I've got several pictures taken during that time. So we have used all the protocol during I was working, but you see, it was difficult to operate, especially in long cases when you get fainted really, because there was an N95 mask. You could not breathe from outside. You were just breathing your own oxygen, which converts into carbon dioxide, goes in and in and in, and you cannot get a fresh air. That is a dangerous one.
So what
Psychologically,
about the children? What about all
children,
the children at school wearing these masks?
this was totally wrong because this was instruction by the government without any science behind. Only the people who were supporting this vaccination agenda and who wanted to sell their product, they 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 supported this idea and they promoted the vaccination and the face mask and the social. I conclude at this stage, they created the fear with the COVID-19 first, locked down the entire country, and they created a fear and anxiety among the public. They got crippled with the lockdown, with the loss of economy, their education, their social and the personal well-being, and they got the mental and the health issues. Many thousand died in nursing homes and in their own homes, and the suicidal rate went up to the sky, followed by the vaccination agenda. If they had not done that, nobody will take the vaccine.
Yeah,
because
absolutely.
They created so much fear of doing all that the people were forced to have vaccination. But there was no need for vaccinating the children. Now they were trying to pass a bill for vaccinating 6 months old, a year old, 12 months old children. That is totally a crime.
It is.
You don't need, we
Absolutely.
have our own system. When we get any infection, our body immune system, that reacts, that produces antibody. That's what Dr. Steve James said in his, you must have seen his video. That's many doctors said about but they proved that it's not something which needed, because he refused. Steve, I must appreciate him that he challenged Sajid Javid, Health Secretary, that
Fantastic.
he doesn't need any vaccine because he had a COVID and he had developed antibodies, and I agree with him. There's no need
Yep.
for that. Almost everybody have been hit by some sort of a symptom with usually people had this symptom before, but now anybody who coughs or gets fever say, oh, this chap has got a COVID, and the long COVID and the short COVID. It's such very strange terms have been introduced, I don't believe.
What is long COVID? I mean,
I don't believe on a long or short COVID.
So we know that the flu disappeared. Where did the flu go?
Well, if the scientists are listening to me, the SAGE and the UK scientists, they should come and debate with me, and I can debate with them anywhere on the channel of their choice. If
Fantastic,
they want to disprove me, I'm happy to join them at any channel. So what is long?
They won't debate you. They won't debate you.
Yeah, bring my team. I bring my team of scientists across the world, and they bring their team, and we make an argument for the public's sake, for the sake of people. If they have done the mistake, why should I follow them? That's what because I did not follow the government instructions and medical establishment and the General Medical Council and Trust crucified me because of their instructions.
Yep, absolutely.
That's why I'm standing. I'm going to High Court. I had a freedom of speech and expression, not as a common person, which everybody has got. We've got a freedom of speech and expression under Article 10, 1 and 2.
Yep.
And everybody has. All of us have. What we're talking is if freedom comes into freedom of speech. We're not abusing anybody. We are trying to find out the best possible solution. That's what I tried in the very beginning, for the sake of public. I spoke very gently. I told them this is an alternate way to have a scientific debate with the scientists to come out with a better solution. But nobody listened to me. And instead, they crucified me by dismissal, followed by suspension by General Medical Council. One question is General Medical Council. They have no role to play in propagating or enforcing the vaccination agenda. This is none of the General Medical Council duty. It's not. It's the NHS who is responsible for the health. The General Medical Council role is to register somebody, check their degrees, check their equivalency, and they neither maintain the high standard, nor they protected the patient in the last 3 years, nor they have safeguarded the public, they claim. And they have actually damaged the health system and the confidence of the public and the medical profession. And they are using Medical Act 1983, which is gone very old. It's 40 years old. And that needs changing. And they're hiding behind that case. And most of this General Medical Council is run by the bureaucrats, by the legal and the paralegal, because they prolong the cases for 4, 5, 6, 7 years. Many innocent people, they are declared, many doctors declare innocent at the end. But how much damage they would have caused them. This is not the way that they are doing it. It's inhuman. It's totally discriminatory, especially to the doctors from the ethnic minority who are considered to be backbone of the NHS in many ways. But they're targeting them to give a message across to the wider community. That's what the British Medical Association, the Medical Defence Union, and the Medical Protection Society, and the other medical authorities have done the survey, and 67% doctors have lost total faith on General Medical Council, and they have said this organization has gone totally out of control, and that need to be abolished completely, and should be replaced with a new medical council who could have uh, faith of the doctors as well as public and patients, and
Yep.
with the dignity, not the way they are doing. So many doctors, you know how many doctors have died in last 15 years, from year 2005 to 2020. In 15 years, 200 doctors died during the GMC investigations. Out of that, 60 doctors, 60. I've got a record in front of me here, and I've sent it to everywhere in my posts.
Okay.
That 60 doctors suicided during the prolonged GMC investigations for years and years. And recently, the General Medical Council chairman, Mr. Macy, has apologized from Manjola or Dr. Manjola Arora, from GP from the Manchester. You must have heard about that.
Right.
And the only allegation was that she has asked for a computer to work on that, and that the cost of the computer was only £300. And she was alleged as a dishonest, and she was suspended by the Medical Protection Tribunal. And after 16 months, she went to the High Court, and then the High Court declared that she was innocent. And you know how much the Medical Protection Society in 10 days trial have charged? £45,000.
Wow.
For £300. If this doesn't come into probity, they ask us to be honest, and how much honest they are. In fact, how much honest they are.
They're not, are they?
So £45,000 of £300 worth of, was it worth of doing it?
No.
And similarly, there's so many doctors who are suicided. Recently, Dr. Michael McPhillips have suicided on a threatening letter sent by the General Medical Council. He was a consultant psychiatrist in London. He treated so many celebrities, a Cambridge graduate, and he committed suicide after receiving a letter from the General Medical Council. And the coroner, Dr. Anton Allen Dillon has said in his report, I have no hesitation in concluding the contents with the letter of the General Medical Council contributed to the state of mind of Dr. McPhillips and contributed to his suicide. That's what he has written.
So does that mean that obviously now the doctors, are they all getting together because they are not happy within the system and they want to see a change?
No, they are misusing the Medical Act 1983, and if doctors are answerable to the General Medical Council, whom General Medical Council is answerable to, and they are answerable to Parliament, but Parliament is stuck in their own problem. They don't bother about how many people have died, how many have suicided, and how many have been maltreated. This is the role of the Parliament to look into the matter. They can't just give a green signal for crucifying the doctors, especially belonging to the ethnic minority.
So what about the fact that we are still facing, even now, we are still facing people that can't have surgeries or treatment unless they do a PCR test and are vaccinated? We are still facing this.
The still system, they just want to carry on because they have started that. They don't want to withdraw it. They want to continue that.
So they have to kind of,
without any justification.
So are you representing yourself in court?
No, I'm represented by a very experienced law firm, which is a PJH law firm, Mr. Philip Highland, as well as Mr. Francis Hoare. They both are representing me. And again, can you imagine that? We submitted the appeal on 1st of September 2022, soon after I was suspended unlawfully by the Medical Professional Tribunal Service without any reason. without any justification.
They didn't follow due process, did they?
And 5 months, they have not submitted their response at all. Only yesterday, last minute, because they had 2 weeks to the last day, they submitted their response after 5 months.
Let me just have a look at your write-up. Let's see if we can find. So you've got an amazing background. You know what you have done. You've even done seminars teaching other people.
I have
Yeah.
done so many within UK. Yes, I'm not only surgeon. I'm a teacher trainer, as I said earlier. I did two. Last two I did. I've done many international scientific conferences within UK and abroad. The last two conferences which I did in UK before COVID were in my previous workplace in Ride Oldham Hospital in June 2019, and the second one was in September 2019. Very successful. There were more than 500 delegates came in the June international scientific conference, and same number came during the September time. And I periodically travel to different parts of the world for lecturing, for teaching and training, and promoting medical education and representing NHS and the UK. That has been my duty for the last over 30 years. And in July, August 2019, I was invited by 10 different medical universities in Pakistan, and I delivered them lectures. I told them about breast screening, colorectal screening, how the MDT works, how the MNM works, and what I have learned from here. I contributed my knowledge, and we exchanged the knowledge of different diseases pattern in Pakistan and here. So 10 different medical colleges. I not only delivered lectures, but I also conducted workshops and scientific seminars. And I've been doing it on a regular basis. Every
That's
year.
Fantastic.
Within UK and abroad.
So you've always put obviously we can see that you've put the people first, their safety.
First.
Yeah.
And promoted medical education throughout my career. This is what I've done throughout. But this was the setback which I had 3 years ago, and I'm still going through that. Hopefully, I will win the case on 15th of February 2023.
So at the moment, you're not working, are you?
No, I'm jobless. They made me redundant for 3 years without any pay, without a penny. And I had 3 children and a family, and this is a terrible loss of my income and my financial resources. And I had difficulties in supporting my family. On top of that, I lost my reputation, my career, and my long-standing unblemished medical record without a single spot on it. So this is what has happened. It has traumatized my family, my wife, and my 3 children. 2 of them, now one is gone to university, the other 2 are still in school. So their education has been seriously compromised, and they went through a lot of trauma and anxiety and stress, obviously, and that affected their well-being and their education.
Yeah, of course. And obviously, seeing their dad go through this.
And it's a long time. It's 3 years now. It's coming nearly 3 years. When I was suspended first time on 22nd of April, 2020. What I've done? What crime I did?
You didn't.
No. What did I do which justify GMC and medical establishment to crucify me? Was it discrimination? Was it victimization because I look different? Or I did some criminal act? Nothing.
No, you spoke the truth. The truth is not.
Community. I serve this community without any discrimination of color, race, individuality, religion, rich, poor, and I never discriminated anybody at all. I treated everybody equally. I believe in humanity. That's what I'm standing for.
Had you always wanted to be a doctor?
I always wanted to be a doctor, and I became doctor. Came here after my basic medical degree for fellowship, which I successfully achieved very soon. And I've been fully trained in this country for 30 plus years.
Yeah, that's
So
amazing. What do you think now that people are actually scared to go to the hospital and they're actually
people are
willing
scared
to
because they know that there is a long waiting list, 10 million
I
approximately.
think the fear is more than that. I think people are just scared of the NHS. They don't trust the
They are
NHS
scared. They
anymore.
are made scared. They are pushed toward going towards privatization. I said
Yeah,
that a long time ago. If you remember that,
yeah,
I predicted this day, which has happened today. I had a vision to say that on my scientific based knowledge.
yeah. What do you think
And
is going to
people are
happen to the
scared.
NHS?
They are not getting. NHS has gone down into the ditch. It's totally gone on the knees. People are not getting even GP service. They are not able to see face-to-face appointment with GP. Do you get that? No.
No, I've not been able to
On the
see a
phone, you
GP.
listen
I
to them.
can't even get them on the phone.
No, this is the
Even
problem. You can't get the myself. I'm a doctor. I'm with so much qualification. I hardly see any doctor if I get any problem. I ring them. I get a phone call a few weeks later.
yep,
And
yep,
if you people are scared to go to hospital, they know that it's going to be 24, 36 hours, maybe more than that, waiting to get paracetamol and a cough syrup only.
yeah. It's
And they
shocking,
are
isn't it?
they are pushed in this way. They are pushed, and see so many restless here. Is it not obvious that how many hundreds of thousands of nurses are on strike?
Yes,
Hundreds and thousands of social cares are on strike. Social care workers. 50 more than 50,000 ambulance crew are gone on strike.
yep.
And where is the NHS gone? Who is getting benefit out of that? What is their plans? It's not telling to the public. They're not telling exact plan what they're planning to do
If you
to
had
the
to take a
NHS.
guess, what would you
And
say their
it's
plans?
this way. I guess they're pushing public to go to the private sector, but everybody cannot afford that because people
No.
are crippling for their basic necessities, for food, shelter, clothes,
Yes.
health services. This is a basic fundamental rights for everybody. What are the six of them? These are food, shelter, clothes, health services, protection. Yeah.
Yep.
So how many are fulfilled? Are people getting proper health care? They're
No,
all.
people they can't even afford their heating, or they people are choosing
Yeah,
now between heating and food. Which
yeah,
one?
eating and food. People are soon. They're going to. We every day we get scared that after some time their heating is going to be switched off, and people are
Yes.
going to be having cold nights without cooking, without having. Isn't it so much fear? This I think this has to be relieved with some wisdom should prevail. Some
Yes.
wisdom should prevail among the so many politicians and scientists and the medical establishment to look after the public and humanity. This is my voice, and
Yes.
this was my opinion in the very beginning, and I am standing on that. It's not the
You're in
COVID
a,
is present or not. It's not the debate. The debate
yeah.
is what is suffering of the public. How we're going to resolve it.
Yes, absolutely. And so now
Public
we
for
have an
lost
MP.
everything.
We have an MP speaking up, Andrew Bridgen.
Yeah, he has been dismissed. He gave his opinion. Again, it's against the medical freedom of speech and expression. I appreciate him. What he said, he has at least a moral ground. He's a winner.
Yep.
Like myself, I'm a winner on moral ground. People know that I've stood with them, and I showed my face everywhere. That look, I'm still standing with you. And many thousands of people came to listen to me in Trafalgar Square and in different part of the world. And I said what I wanted to say, and
Yep.
that is not a crime to express
No.
my viewpoint.
No, it isn't.
So what for I'm suffering then? What crime I've done?
We live in a sad world when you haven't got freedom of speech, and you are actually, your crime was to tell the truth because you were thinking of the people and not the the wallets of what the agenda was.
Yeah, exactly. If I follow the agenda, I could have been fine. I've been working. If follow the agenda quietly, but I could not tolerate such a lies and false narrative of the NHS and the medical establishment to follow that. I didn't follow, and I had my own opinion. And I suggested them to have a scientific debate before putting the country into lockdown.
Yeah.
This is all because I had my own opinion. That was based on my total experience of 35 years. Yeah?
Yeah.
So that was based on that. And I said that when nobody knew about the COVID virus at that time. And I'm talking about February, March 2020.
Yeah.
So people were frightened and told.
You were with the first doctor when I first started waking up, and I saw, and I was like, oh my God.
I think that's the reason I feel myself blessed to be alive, to speak the truth at that time, to tell the facts to the public that, look, there is some different opinion as well. I don't follow blindly. I'm a leader from the since student life. I'm not a follower.
Yeah.
And I do my work with honesty, with devotion, dedication. I love my patients and do care about them. I respect humanity, regardless of poor, rich, black, white, Muslim, non-Muslim. I respect all the religions. That's me.
That's fantastic. Thank you so much, Doctor. I'm just going to put it out there to see if there's any questions before we end. But honestly, thank you so much. So ultimately, you are in court on the 15th of February.
Yes, that's why I wanted to question the public. You can also, on my behalf, to join us.
You're in the High Court. Where
show the solidarity.
What's the address? Where is it? Which court is it?
I don't have an address as yet, but I just came to know with the limited information as yet.
Right.
By my solicitor that it's at 10:30 in High Court, London on 15th of February 2023.
So we've got
so far,
a hearing.
I have this information.
Yep. Are you joining? We've got a question here. Are you joining forces with any other doctors across the world?
Yeah, they are coming. All the doctors, many scientists, very senior scientists are traveling from different part of the world to join me. And it's a public, open.
No, I mean, I think the lady means in general. I think the lady means in general. Are there a lot more doctors and scientists all coming together now? Yeah.
I can name a lot of doctors. They are speaking from different part of the world.
Fantastic.
And they have now realized that actually what I said was true.
Yeah.
After seeing the effects of the lockdown, the loss of economy, which had resulted in serious problem to the public, and the vaccination injuries and their after effects on the public because of lockdown, which include obviously the economy, the health, the waiting list of patients, and millions of cancer patients that died, and people got complications related to vaccines. So this is serious.
Many people don't believe. There are many people that don't believe that these that they would experience complications from the vaccine. They just didn't believe it. They actually.
I think I don't blame them, because the reason is that they have been brainwashed by constant bombardment of the BBC and the Sky channel. Obviously, they have been very successful. This was a very coordinated movement. between the WHO, between the UNO, and between the scientists and the fake science,
Yeah.
and the heads of the countries. So
Yeah.
this was a global agenda which has been put in a way that they purchased the media as well. You see,
Yeah.
my they wouldn't the mainstream media wouldn't allow me to go on Sky or BBC.
No.
They will not publish my article. I've sent so many articles and told them that this is a science. They never publish that. Who is stopping them?
Mm.
My channel has been removed from the Facebook, from a Twitter account. I had 90,000 followers on that. And I
Mm.
had a YouTube channel. I had more than 300 videos on that. That has been taken down. Is that a democracy?
No. No.
What is a
Absolutely
democracy? This is
not.
a dictatorship.
Yeah.
If you
Democracy
follow
is gone.
the government and don't speak anything, that is a dictatorship. It's not.
Absolutely.
It's not a democracy. UK is famous, have been famous for its democracy and freedom of speech and expression, freedom
Yeah.
of assembly and gathering, freedom of press and publication, freedom of security at work,
Yeah.
and freedom of uh, uh, everything. But
Yeah.
it,
So
but
what
we have
about
lost all
your
those values
country?
now. It looks like.
Yeah. What about your country? What's it like there? Do you know?
Well, that's why I migrated there. I rejected that system.
Yeah.
With more than 30 years, I rejected that system and came here. But now it looks like we are losing our values here. Being a British citizen, I'm still treated differently.
Yeah.
Many doctors. I didn't want to say that, but many white doctors have spoken more than what I have spoken. But they have been given a green signal. But why I have been targeted? And there are a couple of other doctors as well. I can tell you who has been targeted, crucified, dismissed, suspended, conditioned. Is it not discrimination, victimization, and racial abuse?
Yes, of course it is.
Would somebody be able to stop this and stop this happening again to maintain our British values? As a British citizen, I'm talking about, and my
Yeah.
children were born in here. Being a British citizen, I'm treated differently. Why?
It's
What
shocking,
I've
isn't
done?
it?
Again, I'm questioning because
And you
I've
have
given my
every
own
right to
opinion
question.
as a scientist and a clinician. I've given my opinion. That's why I'm suffering from.
I'm so sorry you've had to
I've
go
been
through this.
targeted because of that.
It's shocking, isn't it? Right. So they targeted Dr. Vernon Coleman. Yes, they did. Yes. Doctor, we admire you. We respect you, and
Thank you so
ultimately,
much,
when you
Laura. It's very kind of you for giving me a chance to join you and expressing myself. It has been a 3 years. Sorry, I said so many things which was based
no,
on the way I felt.
no, this is
Whether
good because this is what we
and
want to hear. We want to
people,
hear from a doctor and what you've experienced because we don't always get to see how it's had an impact on the doctors and the
there are
nurses.
many brave doctors. They are coming forward, like Dr. Asim Malhotra and Dr. Samuel White, Dr. Steve James, and Dr. David Cartland, and they all have spoken now. They are coming, but we have been targeted in different way.
Yeah,
That
I
is the only
see.
thing. And many MPs are speaking along with Andrew Bridgen. I must salute and appreciate his point of view, and everybody has a point of view. But this is not
Yeah,
the way that they portrayed it a different way. He never said that. What they crucified him. He never
yeah,
said that. He never said anything about the way he has been treated. And I have sympathies with him. I stand with him, what he said. He was,
Absolutely.
yeah. So his point of view, everybody has a point of view, but doesn't mean that we should follow the government narrative. This is the only difference. The government the state may be wrong.
Yeah.
Scientific advisory group of emergency. They are also doctors like ourselves with similar experience, similar qualification.
Yeah.
Trained in a different, in a similar way.
Absolutely.
So, but unfortunately, we have been treated differently.
Oh, fantastic.
So this is difference. You see, is that because we look different? I look different than the local boys.
Well, maybe they think you're weaker. Who knows? Maybe they think you're an easy target. Sometimes they target you.
Yeah, this is what they said. They think I was easy target, and and BMS says that General Medical Council always target the vulnerable doctors who are either locums or overseas to spread the wider message to the medical community to stop them speaking. This is not me; it's medical association, doctors union is saying.
Yeah. Well, they got you wrong, didn't they? Because you're not weak.
This is the reason I need public support.
Yes, we will be there. I will be there. I will absolutely be there. All I need from you is, as soon as you know the location, just let me know and I will put it out there. But I will definitely be there to support. The comments we have, so many people have so much. No, thank you. Thank you for giving me the chance to spread this word and to, we absolutely want to support you.
For inviting me in your wonderful program, which I very much appreciate. And
thank you,
Doctor.
Time,
and I've said what I wanted to say, so that my message has gone across the world to the public, who should listen and differentiate what I said. Many people might differ from me, but that's fine.
That's fine. We're allowed to have an opinion.
I respect everybody.
Yeah.
I respect who are against me. I respect those who are in favor of me. So I respect all of them because everybody has his own opinion. This is my opinion. My opinion is my freedom of speech. And their opinion is their opinion.
That's right. That's right. And, absolutely. Thank you, Doctor. Honestly, I will be there. I will be there. All I need is we'll keep in touch. It was an absolute pleasure meeting you. We were meant to meet, you see. We were meant to meet. Always things happen for a reason. And the truth, as long as you stand in your truth, and this is what you're doing eventually, I believe, it will win. We will be rewarded for being honest, in good faith, clean hands and truth.
Absolutely. This is what I'm standing for. Without any personal gain. I'm loser from monetary aspect and from my professional side, but morally I'm winner.
Yes, absolutely.
Because millions of people are with me and they support me and they stand by me. I absolutely have a lot of respect for all of them who has been with me throughout the 3 years, and they know me well, and they know I speak truth, and I'm not misguiding anybody. I'm just saying what I feel, and I'm not a hypocrite, and I speak the truth.
And we need people like you. Absolutely.
Truth has already surfaced, but justice will prevail on 15th of February.
Absolutely. And I'm going to be there supporting you. Absolutely. I'd like to be. I think there's quite a few people here that would like to support you as well. So as soon as you give us the location, I will be up there.
Thank
Dr. Adil, thank you so much for your time, for your words, for your truth, and for fighting for what is right. Thank you. Honestly, from me, from everybody here, and I will speak to you soon. And thank you, everybody who's joined us to listen, and we'll be spreading the word, find out where the location is. and we'll be there. Thank you so much,
so
Dr.
much
Adil.
indeed. Thank you so much
Much
for
love.
everybody who's
Bye-bye,
listening to me. All
everybody.
the best. Take care. Thank you.
Bye.
Bye-bye now. Bye-bye. Stay blessed.